So now that we have some understanding of the history of the field and the sort of 19th century foundations of our current knowledge, let's now talk a little bit about how we're able to actually image brain function completely non-invasively in more modern times. So we're going to talk about 4 techniques, and those 4 techniques are sort of the most commonly used techniques to measure brain activity non-invasively, and they're just listed here. So they're fMRI, PET, EEG, and MEG. And I've colored them differently, and you'll find out the reason for that in just a moment. So how can we look into the brain and somehow see what it's doing non-invasively without hurting the person in any way? How can you look inside the head in this way? And there's 2 basic properties of the physiology of the brain that basically enable all of our functional neuroimaging. And the 2 properties are that the brain is both bloody and it's electric. So first of all, our brains, just like our other organs, are full of blood vessels. And so these blood vessels carry energy into the brain. And the more the brain is working, the bigger its metabolic demand. So the more blood flows into the brain and the more blood flows into the area of the brain that is working. And so that's key to the blood-based methods for imaging brain function. And as we've already learned previously, the brain is also electric. So brain activity is essentially electrical activity. So our brains work because neurons pass electrical currents, these rapid signals to each other. And that electricity is something that we can actually, to some extent, measure outside the brain or even outside the head. And that property is what the non-invasive electricity-based methods exploit. Okay, so here's your neuron, already familiar to us. So your electrical current will rush through the axon to the next neuron. And when lots of neurons work together intensely, there is an increase in blood supply to that area. So when there's an increase in neural activity, there's an increase in metabolic demand for glucose and oxygen, and that's what causes the increase in cerebral blood flow to that particular active region. And electricity, so the brain works because neurons communicate with each other, and they do that by sending these tiny electrical impulses, and we can measure the correlates of that electricity outside the brain and even the head. So there are differences between the 2 types of methods, so the blood-based methods and the electricity-based methods. And that is because the blood measures, that's a very indirect and slow measure of neural activity. And that's because the activity will, or the functioning of the brain will happen. And then as a consequence of that, the blood in that region is replaced, in a sense. Whereas electricity is a direct measure of neural activity. So for the techniques that actually measure the electrical activity, the measurement is capturing something that is happening right then. And here's one way to kind of remember it. So the electricity-based methods, so that's EEG and MEG, they offer a measurement of the work as it's happening. So imagine like taking a video of a farmer while they're working. Whereas the blood-based methods, so PET and fMRI, they offer a measurement of the energy supply needed for the work. So imagine like then taking video of the farmer eating their lunch, and if they're having a really big lunch, you assume like, oh, they must have worked really hard. So like I already mentioned, depending on whether the technique take advantage of the bloodiness of the brain or the electricity of the brain, the techniques have sort of different pros and cons. And fundamentally, the big difference is that the blood-based methods, we usually call them hemodynamic techniques, they are able to give us very accurate spatial resolution about where exactly in the brain that activity was happening. So we get a pretty nice spatial map of brain function. But what they're not so good at is giving us fine-grained temporal resolution. So, and they make sense. So the blood kind of flows slowly. It gives you kind of a holistic representation of the general effort of the task in a sense, but we don't get you know, a fine temporal map of exactly what the time course of that function was. And then the electricity-based methods are sort of the reverse of that. So the electromagnetic techniques or the electricity-based techniques, they offer us a very fine temporal resolution. So in fact, millisecond by millisecond temporal resolution, because we're able to take a measurement of the electrical activity millisecond by millisecond, or even faster. But their spatial resolution is not nearly as good as the one of the hemodynamic techniques. And then within the electromagnetic techniques, there's also a relatively big difference between electroencephalography, so that's EEG, and magnetoencephalography, which is MEG. And between these two, it's MEG that is able to give us better spatial information than EEG. So this is the basic map of the 4 main techniques, and next we're going to dive into the details of each one in turn.